Okay. Just hold on a second, guys. Second. Okay. So now the galactose metabolism. Okay, any doubt on it? This fructose metabolism, guys?
No.
Okay. And you should also know one fact about this fructose metabolism, which is, let me show you. Remember, I told you about this glycolysis thing, that the rate limiting step of the glycolysis is this enzyme, the phosphofructokinase 1.
Yes.
Where it is? Yeah. I told you one thing, that the rate limiting step of the glycolysis is the phosphofructokinase 1, which is the slowest enzyme. Okay. And now, as you can see here, that the fructose is entering directly into the cycle, into the glyceraldehyde 3-phosphate. See here, bypassing this complete step, which is the slowest step. Okay. And all other metabolites like this galactose and this glycogen and this glucose itself, they have to pass through this reaction, which is the slowest reaction, right? And because fructose is bypassing all this step and directly entering into glyceraldehyde 3-phosphate, so this is the fastest metabolite, the product, which get into the metabolism fastest. Okay, please remember this fact also. Fastest metabolism occurs in the fructose only. Okay, I have mentioned this. Yeah. Fructose is the only metabolite to bypass the phosphofructokinase 1. Therefore, it is metabolized by the liver faster than any other monosaccharides. Okay. Please note this fact also. Now comes the disorders of galactose metabolism. First thing, you need to know how this galactose is metabolized inside our body. When you ingest the galactose, it will convert it again, just like fructose, by the help of this galactokinase enzyme into the galactose 1-phosphate. Now there is a transferase enzyme known as a uridyl transferase, which uses the glucose, UDP glucose, and exchange the glucose for the galactose like that. It will use the glucose, it will transfer the glucose here to form the glucose 1-phosphate and get converted into the UDP galactose. And finally, the epimerase enzyme again converts this UDP galactose into the UDP glucose. So that uridyl transferase again converts this UDP glucose into the UDP galactose. So ultimately, after this galactose, you will get this glucose 1-phosphate, which could enter into the glycolysis or the gluconeogenesis, like here. Glucose 1-phosphate would be converted into the glucose 6-phosphate. Now you can utilize this galactose into the glucose either or into the glycolysis. Okay. Now the disorders. First is a deficiency of this galactokinase enzyme. Okay, if the deficiency of this galactokinase occurs, then your galactose level in the blood will be raised. And what happens is there is an enzyme known as the aldose reductase. Please do not confuse between this aldolase B and the aldose reductase. Both are different thing. Okay. Aldose reductase found in your blood, and in your blood, what happens is this galactose inside your cells also. Multiple cells have this, like your eye, like your brain, like your nerves, your liver will have it also. So galactose is converted into the galactitol, which is an osmolytically active agent. And you should know this galactitol has a potential to cause a cataract in your eyes. So one of the symptom of this galactokinase deficiency is the cataract. And because you're not getting any galactose 1-phosphate, so you won't get any liver symptom in this scenario. Okay, so the only thing that you will get in the galactokinase deficiency is the cataract. Okay, so we'll get this infantile cataract. cataract in a small children's. Okay, you will get this high galactose content in your blood, which is galactosemia, and you will get this galactose in your urine also. Okay, and because you will get this cataract, so that infant won't be able to see anything. So what he will get is failure to track the objects because he is not seeing anything, and because he do not see anything, he won't develop a smile. So these are the two complaints which parents might show you, which is a failure to track the objects or develop a social smile because the infant cannot see anything because of these cataracts. And cataracts are happening because of this galactitol, because these are osmotically active agent. They will accumulate lots of water inside your lens and will cause the cataract. Okay, any serious manifestation will not see because you're not trapping any galactose inside the liver, so you won't get any hepatomegaly or liver failure thing. Just cataract and this increased level of this galactose. Any doubt? Let us know. Now this classic galactosemia, which occurs due to deficiency of this uridyl transferase enzyme. Now in this case, you are trapping the galactose in your liver. So now you will get this hepatomegaly thing, you will get the liver failure, you will get the jaundice because of it, you will get this high ALT, AST level. Okay. And because you're trapping the phosphate along with the galactose, you won't get any gluconeogenesis, you won't get any glycolysis, you will stop, every other reaction. So what you will get is a very life-threatening hypoglycemia. Again, just like fructokinase deficiency. Oh, sorry, just like this Aldolase B deficiency. So this hereditary fructose intolerance and this classic galactosemia, they will have very similar symptoms. Okay, but one thing more, because you're having this galactitol also, you will get the cataract in this case. So cataract along with the liver failure, you will think about classic galactosemia. If you get just a liver failure without any cataract, you will get this hereditary fructose intolerance. Okay. And one more thing that you need to remember, a fact about this classic galactosemia is the presence of E. coli sepsis. So whenever a neonate with this disease present you, they will always have this E. coli in their blood. They will get shock and they will have this E. coli in the blood, the bacteremia. Okay, and because they will get shock, they will get this the hypotension, the tachycardia, and the trachepnea because of the shock. Sepsis. Okay, please note this fact. The patient with classic galactosemia often have this E. coli sepsis. And so what is the treatment of this galactosemia? Because you need to give the infant milk, of course. So instead of giving the normal mother's milk, you will give them the soy milk, which do not have the galactose in it. Okay. So treatment is a soy milk formula you will give these patients. So any doubt?
Is this E. coli? We can tell that the E. coli is from the classic galactosemia versus the neonatal E. coli, which gives you meningitis from the cataract symptoms, right? Because otherwise, all the E. coli things are gonna come like basically the same.
If you can please repeat it again.
Sorry, chaos happened as soon as I turned my microphone on. So you have E. coli meningitis is like one of the main causes of meningitis in neonates, right?
Yeah.
Exactly. And now you have E. coli sepsis here.
Yeah.
Now, why can this E. coli sepsis convert into E. coli meningitis, or would those be?
Yeah, of course, definitely, because you're having E. coli in your blood, and from that blood, it can go anywhere in your liver, in your brain, in your lungs, in your heart, anywhere.
Okay, cool. Thank
you.
And
this is a very, it is a very important concept. Actually, you should need to remember whenever any organism, I'm sorry about that. Whenever any organism gain access to your blood, it can go anywhere. It can cause osteomyelitis, it can cause the an inflammation anywhere inside your body, it can cause a meningitis. Remember, it can cause the endocarditis, it can cause a pneumonia even. Okay, so please remember this fact. Whenever any organism gain access to your blood, it can do anything in your body. Okay.
Okay, cool. Thank you.
Regarding that,
Yeah.
Because any one way or the other we are learning glucose, fructose, then why does the E. coli only sepsis is only happening with the problems of galactose metabolism? Does E. coli
I
only
really
thrive on
don't
that?
know why this is happening, but it's just a fact. It is
So
seen
we
in many
only when we
patients.
will so whenever we will encounter any metabolism problem regarding the sugar and we have a scenario of E. coli, we must only think of galactose.
Yeah, you will see every you will question over this galactosemia will have this E. coli sepsis. You can
Okay,
feel that. Okay.
okay, thank you.
So whenever they give you cases of E. coli sepsis, you will always think about the galactosemia first. Okay. So any other doubt? Then I move forward now. Comes to the sorbitol metabolism. For that, you should remember two things, that your glucose and your galactose, both with the help of this enzyme, the aldolase reductase, they can be converted into the sorbitol. And you should know that this sorbitol is a osmotically active agent. What does that mean? It is an osmotically active, which means it will, takes the water with it. So whenever this sorbitol start accumulating anywhere inside your body, and most importantly in your lenses, in your retina, in your kidney, in your Schwann cells, because it is osmotically active, it will draw the water with it inside these cells. Okay, and you should know this aldose reductase will require one of this NADPH. And if you get too much of glucose, like in case of diabetes mellitus, or here in case of galactosemia, you will get what? The depletion of this NADPH stores. And once you get this depletion of NADPH store, what you will see? Damage from the reactive oxygen species. So this is two things happening. First, that the sorbitol is an osmotically active agent, so it will draw the water with it. That is the one cause of getting cataract. And secondly is because you are having this damage from the reactive oxygen species, that this is the second reason why you are having this, the cataract from this sorbitol. Okay. And if the cells have this sorbitol dehydrogenase, then they will convert the sorbitol into the fructose and nothing will happen. But then there are some cells which have this enzyme only, not this enzyme. And that is the time when real damage occur to these cells. And that includes your lenses, because as you can see, the lens has only the aldolase reductase, and other like retina, the kidney, and the Schwann cells, they have only this aldolase reductase, not other enzyme. While your liver, your ovaries, and your seminal vesicles have both of this enzyme, the aldose reductase as well as the sorbitol dehydrogenase. So they won't get to face any damage from this sorbitol. But the retina would be affected, so you will get the blindness. Your lens would be affected, you will get the cataract. Your kidney would be affected, you can get the liver failure, the kidney failure. The Schwann cells will be affected, you will get the peripheral neuropathy. And that is the reason, again, very important reason why you get all these things, the blindness, the cataract, and this neuropathy in case of the diabetes mellitus. One of the causes sorbitol. Okay. And you should know that it is this is a alcohol counterpart of the sorbitol. Okay. Sorbitol is the alcohol counterpart. Okay. Please remember this fact again. Any doubt?
No, go on.
So please remember these names, which organs have this both enzymes, and which organs have just the aldose reductase. Okay, what this sorbitol can do, why the damage is being occurring, because of two facts. First, the sorbitol is osmotically active, and second, the NADPH depletion causes that damage from reactive oxygen species. Now you should know about this lactase deficiency. Lactase is basically an enzyme that digests. Yeah. Someone say something?
Yeah. You know the lac operon thing?
Yeah.
In genetics. So
Yes.
does it relate that part to this
No,
E.
no,
coli?
no. Both are different things. Lac operon is only in the E. coli only, not in the humans.
Yeah. That's why.
Different things.
Okay. I mean the E. coli infection by in the galactokinase deficiency.
No, it
No?
could be a reason, but no, I really
Okay.
don't know the reason why it is happening. I just know the fact.
Okay.
So now the lactase deficiency, lactase is basically an enzyme which digests your lactose. Remember
Sorry,
what sugar make the
excuse me.
lactose? Glucose and galactose, right?
Excuse
So
me.
this lactase enzyme actually digests the lactose into the glucose and galactose. Okay, and you should know the location of this enzyme. It is in the intestinal brush border epithelium. Please remember this location. It is very important. They will ask you the location of this enzyme. It is intestinal brush border epithelium. So whenever you get a damage of your intestine, for example, any case of enteritis, like viral enteritis or the bacterial enteritis, like Whipple's disease, or might be a celiac spur or anything like that, you will get what the damage of your intestinal brush border epithelium, and you will get this lactase deficiency also. So whenever you ingest the milk, what you will get the diarrhea, the bloating sensations, the abdominal pain,